we're live. Yes, I'm live. We're just waiting for you, I guess. Hi, everyone. Welcome. Another live on a Wednesday evening. We do have our wonderful guest here, Dr. George Bitar. Yeah, go ahead and click on it. Gerda, can we also make sure Dr. Bitar's
Hi, everyone.
Great
to be here, Yalda.
Thank you, thank you. Glad to have Dr. George Bitar, one of the best plastic surgeons in DMV. I'm honored to have you here. Thank you so much.
Thank you. Great to be here with you.
Of course. Would you also make sure Dr. Bitar see his questions? Yeah, thank you so much. So guys, our goal for these lives is always patient education. We really want to educate you guys, give you all the options you have there as far as when it comes to surgical, non-surgical. And I mean, I always make sure we pick the best in the town. So here, Dr. George Bitar.
Well, thank you very much, Yalda.
Of course, yeah, thank you. Our guest's going to be asking some questions, but before that, would you like to go ahead and tell us a little bit about yourself? Tell us what you do in your practice, and just let us know about you a little bit more.
Well, you know, Yalda and I have been friends for a long time now, and it was a great pleasure to come and join her here. And I think we do share in the fact that we both enjoy educating our patients and making sure that you get the right information. I'm a board-certified plastic surgeon here in the Washington, D.C. metropolitan area. I have a surgery center and a medical spa, a med spa with estheticians, PA injectors, myself, and a full team with plastic surgery patients and injectable patients and skincare patients. So we sort of have the gamut of all things cosmetic.
Yeah.
And we love educating our patients. We love being involved in education. We have a fellowship in our practice. So we train a plastic surgeon each year to become a fellowship-trained aesthetic surgery fellow. And we have medical students, residents, nurses coming and rotating with us to learn. So our doors are open for education, and we are also very big on educating our patients on Instagram.
Absolutely.
I love doing all cosmetic surgery, so all my practice is limited to cosmetic surgery. I do facial, rhinoplasties, and body cosmetic surgery. So with that, I will let you and your Instagram followers please ask any questions. I'll be happy to answer them.
So I know a lot of my patients, knowing that we're having a plastic surgeon joining us on our Instagram live, so many of you guys were asking about breast augmentation, and I know that's one of the huge question that everybody has, that, all right, I want to get my breast augmentation, but a lot of us are concerned and worried about the scars and whether this scar is going to be visible, what other options they have. So I really want you to go over all the options and what can be done for this lovely patients that they're so afraid of that scars around, whether it's a nipple or under the breast.
So I have a huge breast augmentation practice, both for primary augmentations, meaning people who've never had breast implants before, and people who've had them before and they want them revised. For the patients who don't want to have scars on their breasts and have never had a breast implant before, my preferred technique is a transaxial breast augmentation, which means a breast implant from the armpit behind the muscle. I either do it with saline implants or silicone implants. In the last 10 years, silicone implants have been FDA approved. We do the gummy bear implant or the highly cohesive gel implant. They're excellent. They feel very natural.
Yeah.
And we're able to put them from the armpit behind the muscle. I say I go up to about 600, 700 cc's. So people who are afraid that they cannot get their implant from the armpit, you know, with the experience that I've had with thousands of implants, I can do it from the armpit for almost any size. And the advantages of doing a breast augmentation from the armpit are many. Number one, you don't have scars on the breast. Number two, because it goes behind the muscle, I don't have to cut the muscle and suture the muscle, which means it's less painful and it heals better. Number three, you're nowhere near the milk duct, so you can breastfeed afterwards. You're not near the nerves that innervate the nipple, so the chances of losing nipple sensation are almost less than 1%. And because I don't go through the breast tissue, you don't have scars on the breast, which means
That's huge, yeah.
with mammograms, you don't
Have
get
any
confused
issue,
with scars, whether they're scars or whether they
tumor.
are cancer. So there are a lot of advantages, and that's why I love this technique, and I do it mostly from there. Now, people who've had previous breast implants who want to have breast implant revisions is a little bit more complicated, but we do a lot of them because there are about 4 million women in America who've had breast implants. So obviously ones who've had them for a long time and are not happy with them, they had them before they had children and now they've drooped after they had children, or breastfed, or they've gained weight, they've lost weight. So we do a lot of breast implant revisional surgery. So if you are one of those people who thinks you've had a breast implant 20 years ago and you have problems with it, there are solutions for that. So do your homework. There are a lot of good board certified plastic surgeons in this area who do breast implant replacements, revisions, breast lifts with implants, and we'll be happy to answer your questions either here or at my institute at the Bitar Cosmetic Surgery Institute.
So one of the guests are asking this, what is the lowest CC in breast augmentation?
I have put as small as 75 cc's, but I mean, that's a pretty small number. I think that's the lowest that the implant makers make them.
Already. And how often those implant needs to be changed?
So I don't change implants just for a time number,
Right.
Meaning I only change implants if there's a problem. If there's no problem, I don't feel the implants need to be changed. So there is the old breast implants that were liquid silicone implants. They would recommend that they need to be changed every 10 years because they were afraid of leakage. But the new breast implants that are silicone gel are highly cohesive, they don't leak, and have a much longer longevity. So in summary, if there's not a problem, I typically recommend that the implants don't be changed.
All right, good to know that. And for the folks that they need breast lift, what are the options for us? Because those are the one also that concern about the scars. So what options do they have?
So breast lifts, now that we have high profile breast implants, a lot of the times I do breast lifts with actually the choice of the implant. So if you choose a high profile implant, the implant itself, if it's put behind the muscle, can cause a lift. Other ways of doing a lift are either the donut lift or the scar around the areola, the lollipop lift, which is a scar around the areola and the scar, a vertical scar below the breast, or an anchor incision lift, which is around the areola scar, a lower scar, and underneath the breast. And the type of breast lift with the implant or without an implant will depend on the patient preference, the doctor preference, and the patient's anatomy. If a breast is just a little droopy, you need a little bit of a lift. And sometimes if you do an implant, the implant itself can give the lift, so you don't need to put any scars on the breast. But those are things that I discuss with my patients when we're in the consultation.
Got it. All right, so last question would be, what are the complications that can happen with breast augmentation, whether it's breast lift or replacing the implant?
So I tell my patients there are no surgeries without complications. So any type of breast implant does have a risk of bleeding, infection, capsular contracture, meaning you can have scar tissue around the breast that can be hard, loss of nipple sensation, loss of ability to breastfeed. You may simply not be happy with the result because the size that you picked was not the right size for you. But all these are small amounts, less than 1 or 2% in my practice. And I think the key is to do your homework, to sit down with your plastic surgeon beforehand, know exactly what you're getting, know what type of implant you're getting, know how many cc's. We have the patients put implants in their bra, look in the mirror, and spend a good 20 minutes deciding on the implant. So as a result, our patients are very happy with their implant sizes.
All right. So can we change the topic now?
Absolutely.
All right. So let's talk about...
I think I need to ask you about...
Yeah, if you could just go ahead and set his...
Please.
Thank you.
Great.
So, alrighty. So we do have our patients or our followers asking about your non-surgical model lift. So can you tell us more about that?
Sure.
So, and we love the name, by the way.
So my model lift is trademarked, so I love it too, because I when I was thinking about a way to convey to a patient if I'm going to give you the most beautiful result I can, without surgery, how would I be able to convey it? And the reason why I came up with the name the model lift is because...
We love the name, by the way,
right.
Best name.
Thank you.
Seriously.
Models all have one thing in common. Whether you're an Asian model, a Hispanic model, an Arabic model, an American model, they have good proportions.
Yeah,
the proportions between the cheek, the nose, the lips, and the jawline all
the angles,
match.
Right?
Yeah, you can't be $1 million model if your proportions are out of whack. So models have the beautiful, youthful-looking proportions, and they can be adjusted based on ethnicity. We have patients right now, we have counted from about 114 countries that have come to our practice. So we deal with facelifts, rhinoplasties, model lifts on people from all over the world. And it has given me the opportunity to study the different ethnic backgrounds, the different thickness of the skin, the different preferences around the world.
Yeah.
Somebody in Lebanon versus Colombia versus Norway are going to want different, things, to enhance their beauty. What the model lift is essentially is to improve those dimensions, whether it is the cheeks, the nose, the lips, or the jawline, to make everything seem harmonious.
Absolutely.
And it's not about making somebody even look younger, it's making them look prettier. Because if you're a 19-year-old girl with a deficient chin, you don't need to be looking younger. You just want the chin to match your cheeks and balance with your nose. And similarly, if you're a 30-year-old guy who has a very deficient jawline and makes him not look very masculine, doing volumizing of the jawline and doing fillers on the jawline to give him a very nice jawline, is part of the model lift. So it's not really an operation, it's a philosophy and a concept of taking somebody and with the knowledge that I have of anatomy, giving them the most beautiful face that I can give them.
Yeah. So when we do have a question.
So
Go ahead.
We have a question from a patient. Sticking to the subject of facial balancing, we want to talk about ethnic rhinoplasty.
Sure. So ethnic rhinoplasty is one of my favorite operations because I feel that I come from the Middle East and I have a lot of Middle Eastern patients from Lebanon.
From Middle East. So
we
do have a Lebanese surgeon here.
That's right.
Iranian nurse. So the combination, guys.
So because we have patients from all over the world, and when I finished my training here in the United States, I did an aesthetic fellowship around the world, as you know, Yalda. So I trained with the top 6 plastic surgeons in the world, and I think part of my training was to be able to understand different cultures and what they want out of their surgery.
Yeah.
And nowhere is that more important than with noses. Because, a facelift on somebody from Africa or South America may be quite similar, but a nose job is very different.
Isn't it one of the most
So it is one of the most artistic one of the most difficult operations to get it right, because you don't want to give a Norwegian woman a nose that would be not, that does not work with her face.
Absolutely.
You don't want to give a woman who is 70-year-old the nose of a 16-year-old. So every nose is different. And if you go on my website, you'll see that there are no 2 noses that are the same.
No.
And a big part of that is sitting and listening to the patient. You got to listen to the patient
and
about what
really
they want with their nose, because sometimes people want something very minuscule and sometimes they want a lot. So with ethnic rhinoplasties, there are certain things that need to be explained to the patient, meaning the thickness of the skin is going to affect the result, it's going to affect the healing, and it's going to affect the outcome. If somebody has difficulty breathing, they need to have a breathing operation along with their cosmetic needs. And I do a lot of septoplasties and breathing operations to improve the breathing, because you don't want to have a beautiful nose but then not having all the time. I do them both together. So about 65-70% of the time I'm doing a cosmetic rhinoplasty. I have to do something with the septum or the turbinates or improving their breathing, because a lot of my ethnic rhinoplasties are revision rhinoplasties. People have had their noses in Dubai, in Kuwait, in Iran. They're not happy with them. In South America, they come and I do a revision rhinoplasty on them.
So sharing my own experience, I had a rhinoplasty about 10 years ago. And my first rhinoplasty was not successful, because I agree, you have to go to a surgeon who knows about Middle Eastern anatomy. So you really have to know your anatomy, but you really have to know your patient and where they come from, because having a rhinoplasty on someone who is Caucasian is absolutely different with someone who's African American. So I have seen your work. You do a lot of work on people from all over the world or different ethnicities, so I admire that. Yes, sir. What's our next question?
So we have a patient asking a question for Nurse Yalda. What is the difference between a surgical and non-surgical rhinoplasty, and what can you do with a non-surgical rhinoplasty?
So I do non-surgical rhinoplasty, so as Dr. Bitar. Obviously, if you do need rhinoplasty, if it's something that cannot be fixed using dermal filler, you do need to go see your surgeon. So as far as non-surgical rhinoplasty, we use dermal filler. I know you do use Radius. I do use mostly hyaluronic acid, so Voluma.
So Restylane, Voluma, or
Radius. And I know Dr. Bitar also focused on the tip of the nose. That's not my specialty. Usually I do non-surgical rhinoplasty if there is a little bit hump on their bridge, and we can just make that more like smooth the bridge a little bit. And then for you, I know you do a little bit of tip.
So I'm aggressive with my non-surgical rhinoplasty.
I have seen that. So one day I shadow him, and he just doesn't.
I do a lot of non-surgical rhinoplasties, but I mean, I think the key, if you want to have your non-surgical rhinoplasty and you have a complicated nose, meaning a nose has been operated on before, or a nose that is a little bit more difficult than just having a small bump, you know, I think as a surgeon who has done surgical rhinoplasties, I feel very comfortable doing it. I say that in meetings, and I've told that to my nurse injectors. If you don't feel comfortable working with a nose that has scar tissue or is complicated, don't do it, because you will not be doing yourself or the patient a favor.
Can you tell us how many years you've been practicing someone's?
Sure, I've been practicing for 20 years right now, and I've done probably over 20,000 surgeries. So
he started when he was 10, so it all makes sense.
I wish. But I think with the non-surgical rhinoplasties, I think the thickness of the skin, the scar tissue, it all has to be taken into consideration. And sometimes, because I do a lot of consults on people who come to me for non-surgical rhinoplasties, and basically I tell them, you're not a good candidate for a non-surgical rhinoplasty. You need to have a surgical rhinoplasty. Or sometimes I tell them a non-surgical rhinoplasty is going to give you a 50% improvement, whereas a surgical rhinoplasty is going to give you a 90% improvement. You choose.
You choose, yeah, absolutely.
The one key point I think that's important to understand is a non-surgical rhinoplasty is not the equivalent of a surgical rhinoplasty, but it's temporary. Meaning the things that I can do with a surgical rhinoplasty are way more than the things that I can do with just injecting a filler. Absolutely. You know, you cannot make the bridge of the nose thinner with fillers, and you cannot and you cannot make the tip thinner. You cannot make somebody breathe better with fillers. So a non-surgical rhinoplasty does have its limitations.
For sure, absolutely. So would you tell us a little bit more about the closed rhinoplasty and open?
Yeah. So a closed rhinoplasty is basically when you are operating on the nose without making an incision at the bottom of the nose.
Right.
An open rhinoplasty is when you're making a rhinoplasty with an incision at the bottom of the nose. They have pluses and minuses. I think the non-surgical, the closed rhinoplasty essentially does not leave a scar at the bottom of the nose. Now, because I do a lot of combination rhinoplasties with upper lip lifts, you have to have a scar if you want to deal with the lip and the nose at the top.
Oh my God! So is that true that right after rhinoplasty, if you don't do the lip lift, there can be a distance between your upper lip and the nose? Is that a possibility?
It's not going to increase the distance, but it's not going to decrease it.
Okay.
Which means that if you want to have a lip lift and you want to have a nose job, the time to do it is the right time. Absolutely. And I do a lot of combination, because the scar at the bottom of the nose to do an open rhinoplasty is the same scar to do a lip lift. And I do a lot of those combinations, and people love it, you know, because you're getting 2 for 1.
No, absolutely. I do highly recommend it, because it just decreases the distance between your upper lip and your nose.
No question.
It gives you a little bit more volume on your upper lip. And as we all know, when we age, this distance gets longer.
Sure.
So that's really going to be a beautiful treatment. I mean, surgery that it can also take away 10 years away from you and make you look much younger.
Not only the distance, but also it gives you'll be able to show your teeth a little bit.
Absolutely.
And what you want when you smile is you want your teeth to show, because if your lips cover your teeth, it's kind of like not nice.
You want to
and
show that beautiful smile,
there you
basically.
go. And the other thing that I have noticed with my patients that I've done a rhinoplasty and an upper lip lift at the same time is they need less fillers. Maybe that's not a good thing to say here. But when they're happy with their lips being lifted, they don't need to fill them as much because now they are naturally with a height that the fillers are not going to be able to give. A filler fills the lip, but it does not make the lip higher, whereas a lip lift makes the lip higher.
No, I will go ahead and reveal the secret. I did have a lip lift, and I mean, I couldn't be happier. Absolutely. You can go much longer without needing to do lip injections. So I do highly recommend this, especially for patients who want to do surgical rhinoplasty, get both together. Yeah, go ahead, next.
Okay,
please.
we have a question, yes.
So we have a question from a patient asking about your signature suture suspension neck lift.
Good. Well, I like talking about neck lifts. So I started doing neck lifts in my fellowship before I even started my practice. So I've been doing it for about 22 years now. And the neck lift that I do, I think the special thing about it is that I do it with scars behind the ear. So if you want to wear your hair in a ponytail, you don't have the scars limiting you. And it's a great operation for men who don't want to have the stigma of having had a neck lift with scars in front of their ears.
That is wonderful. Yeah.
That's one good thing about my suture suspension neck lift. The other thing is it's permanent. So when I do it, because I tighten the muscles, I take care of the fat in the neck, and I take care of the skin, and the scars are behind the ears and a small scar underneath the chin. It's a permanent operation. I tell people you're going to die with a nice neck. And I just recently wrote a chapter in a book on neck lifts that anybody who's interested in having it, it's available at our practice.
So you remove the fat doing liposuction.
Correct.
You tighten in the skin by just pulling the muscle.
By tightening the skin by cutting the extra skin. So when somebody basically pulls on their neck like that, that's the amount of skin that I remove. And I tighten the muscles under the skin.
How do you tighten the muscles?
I suture the muscles together, and I put 2 stitches that lift up the muscles underneath the skin. So basically, it's a permanent operation. You never have to worry about your neck again.
No, because I know a lot of patients notice, especially when they're looking down, they can see that neck is getting heavy. So usually
we're doing tons of them now with the Zoom
meetings.
and phones and stuff. The one thing I would also like to say about this is, neck lifts used to be about looking younger. Now neck lifts are about giving people a nicer jawline. So I do neck lifts on 20-year-olds, on 25-year-olds, on 30-year-olds. So it's no longer an operation for older people, but it's an operation to give somebody a chiseled jawline.
So
sometimes combining it with a chin implant, you get like an amazing jawline between the neck and the chin.
So if someone has a very heavy tissue, if the skin is very saggy, you would not do a filler for them to create that jawline, because
filler is not going to help. If somebody has a very heavy jawline, they either need a neck lift or a facelift.
Got it.
And I tell them a neck lift is going to give you maybe 50% improvement, whereas a facelift is going to give you an 80% improvement. And I let the patients decide.
So a patient is asking about our skin tightening devices, and I know that you offer all therapy, and we offer at Rejuvenation Clinic Morpheus 8. So if you guys could talk about that and the pros and the cons of both of those devices. Yeah,
so I want to hear from Yalda about your Morpheus 8.
So, it's a combination of 2 technology together. It's a microneedling and radio frequency. So it's 2 technology, and as far as the radio frequency, they're almost 25 needles. It goes down up to 4 millimeter to your dermis. In addition of the radio frequency, basically we're causing some controlled trauma to the skin. We're forcing the skin to go through recovery phase, therefore more collagen. And we ask our patient to do between 3 sessions. Each session can be about 8 weeks apart. Mainly we do that treatment for the face. We do the entire face, and we also include the neck, because I always, I don't separate the neck from the face. And I know all therapy, it's more like ultrasound.
So all therapy is ultrasound based, and it heats and lifts. So somebody who does not want to have a facelift, I think therapy is going to be a more deep treatment and lifting, whereas Morpheus is going to be more dermis and skin. And I think the combination will be great.
So how many sessions usually a patient need if they want to do...
therapy? I mean, the nice thing is therapy is a one-time deal. So we have them doing it. Yeah, it can last about 2 to 4 years. So we have people that we put on a maintenance treatment, like you come back once every year or 2 years. But even, after 2, 3 years, we still see a nice improvement from before.
That is amazing.
I think that we are at an age right now where people want to have a non-surgical way of improving their face. They want prevention. People who've had facelifts 10 years ago who don't want to have another facelift, they want to come and have either laser resurfacing, they want to have fractional treatment, they want to have all therapy. So I think it's important for us to be able to listen to our patients and know what bothers them and give them what they, what's going to make a difference for them.
So when it comes to body contouring, I know that you do offer non-surgical when it comes to cool sculpting.
Yes, so cool sculpting has been around now for about 10 years. We, at the beginning, when it first started, I was not impressed. But then the third and fourth generation, I liked it. I felt it gave good results. And as a surgeon who does a lot of liposuction, I didn't want to offer my patients a treatment that was going to be, that's not going to work. So with the newer Cool Sculpt treatment, A, you are more aggressive, and B, you do more sessions, so you get results that are comparable to liposuction. Now, if somebody wants to have a etched body, the Cool Sculpt is not going to do that. The Cool Sculpt is going to reduce the fat. It's not going to give you a high definition liposuction look. That is liposuction. But if somebody is bothered by a few pounds of fat around their waistline or in their thighs or in their arms, I think Cool Sculpt is a great alternative to liposuction.
Absolutely. And I know you have now offering M-Sculpt, and I know that's going to be helping with tightening the abdomen or for buttocks.
The buttock muscle. So M-Sculpt is electromagnetic stimulation of the muscles, and it can do things that we as human beings physiologically cannot do. It makes the muscles contract, so it does two things. It increases the muscle mass and increases the number of sarcomeres, which are the muscle subunits. So with that treatment, doing it for the abdominal muscles and the buttock muscles, we've had some very happy patients. Again, it's not a substitute for going to the gym, but some people want to have an extra kick and extra definition of their muscles. Some people are athletes who are now bedridden because they injured their leg, but they still want to work on their abdominal muscles. So it has a great usage for us.
So how many sessions usually they need, and if they stop, the results will go back from day one?
Yes, right? I mean it's like going to the gym, and it gives you it puts you on fast forward in the gym or on steroids. It increases your muscle mass. But, it's the best way to use it is, in conjunction with working out, not as a substitute to working out.
Good to know. What other question?
All right, so I know that you did mention liposuction earlier, and we want to know what's the difference between high definition liposuction and standard liposuction? Okay,
so the question is, what's the difference between high definition liposuction and just regular liposuction? High definition liposuction has come around in the last 5 to 10 years. Basically, when we as plastic surgeons look at the human body and see the beauty of the curvatures and the beauty of where the muscle interacts with the skin, we can mimic that when we do liposuction on someone. For example, if in the past we would just do liposuction on somebody's tummy to just remove fat, now when I do liposuction, I try to enhance their existing muscles. So like earlier today, I did the tummy tuck and liposuction on a woman with high-def liposculpture of the abdomen. So, by tummy tuck...
That's why we were supposed to do 7 p.m., but the man was in the operating room, so we had to postpone it to 7:30. But we appreciate
I apologize about the delay. But so basically what I did was I removed the extra skin on this lady who's had kids. Then I tightened her muscles, but then I did liposuction on her abdomen at the midline and on the sides of the rectus abdominis muscles or the midline muscles and her obliques. Okay. And I did high definition liposuction on her thighs and her back. So it sculpted her breast and her tummy in a way that is not just fat removal, but it just enhances, her normal anatomical physique. Yeah. So that's And sometimes we combine that with injecting fat. So when I do my Brazilian butt lifts, and I do a lot of those, I take the fat from the abdomen, I do high def sculpting for the abdomen, and then I turn around and inject the fat in the buttocks to give a nicer shape for the buttocks. Yes.
Someone is asking, so if someone doesn't want to have, they want to have breast augmentation, but they don't want to use silicone or saline. What are your thoughts on the fat injection?
So fat injections on the breast is a complicated topic because if you inject fat in the breast, I personally don't like to do it. I inject fat everywhere in the body except the breast. And the reason is because when the fat dies, and some of the fat will die, and then you get a mammogram, the scar tissue of the fat injections, can on a mammogram look like breast cancer. Unfortunately, 1 out of every 9 to 10 women is going to develop breast cancer in her lifetime. Those are the statistics. So if you inject fat, you are sort of, making the mammograms a little bit less accurate to read. Furthermore, when you inject fat in the breast, there's always risk of having cysts from the fat injections, and then you have to get mammograms to look at them in the future. So having done thousands of breast augmentations and having had great results, I feel that injecting fat in the breast needs to be done, A, by a plastic surgeon who does it a lot, and B, you need to understand that it's a more complicated process, will cost more, and may take more sessions to get what you want. So I'm not saying that you shouldn't do it, but I think if you want to do fat instead of breast implant, do your homework.
That was a great explanation. Thank you. Dr. Bitar, so for the chin implant, so when patients want to have augmentation, if they have had filler in the past, whether it's been radius or hyaluronic acid, are they still a candidate for chin implant?
Yeah. So I do chin implants on people who've had fillers in their chin all the time. And I do rhinoplasties on people who've had fillers in their nose all the time. So having fillers in the chin or the nose in the past, or even fillers under the eyes, and then I do lower eyelid lifts, I feel that I typically tell my patients the minimum I would like to wait between a filler and the surgical procedure is about 3 months. Okay. So if you've had fillers in the chin or the nose, after 3 months that filler softens up and I think you can go ahead and operate. I did yesterday a rhinoplasty on somebody that I have done fillers on their nose in the past, and then yesterday I did the surgical rhinoplasty because they were happy with the fillers, but they didn't want to keep getting fillers every year. So with the chin, it's the same thing. People get fillers to their chin, they like it, but then they say, I want something more permanent, and that's where a chin implant comes in.
So someone is asking, what if the chin implant is whether too small or too big? What are the options?
We have sizers. So when they come to the office, we just like we do sizes for breast implants, we do sizes for chin implants. So usually we hit it right on the mark. I don't think your follower needs to worry about implants being too big or too small. Now, I can tell you that a rule of thumb is I draw a line between the lip and the chin. With women, I like to approach that line with a chin implant, meaning have the chin almost at the level of the lower lip. With men, I like it to be a little bit in front. So with men, I like to give a stronger jawline and a stronger chin.
More masculine.
With women, I like it to be a little bit softer. But again, that depends on the patient. Sometimes a man would like to have a smaller chin, and a woman would like to have a bigger chin. So that comes out in the consultation. And sometimes, just so we're talking about chins, I do chin reductions. Sometimes a woman with a very strong chin, I go and I burr down the bone and I bring the chin inwards. So it can go both ways. We can make the chin bigger, we can make the chin smaller.
All right, these are really good questions.
We have another question?
So we have a question from the guest asking about non-surgical rhinoplasties using threads.
Okay.
That's not my expertise.
That's not my expertise, and quite frankly, I shrug when I see it on social media.
I always suggest to my patient, you want to do it the right way.
Yeah.
It's not the cheap way or it's not the easy way. You want to really do your homework. You just don't want to constantly do thread and then end up having more scar tissue. Because with this PDO thread, even though I do PDO thread lift for maybe some neck or your jawline, but I do not suggest it for the nose because it's so easy to end up with so much scar tissue, more complication, and you really want to have something done that it lasts you longer.
Well, and also when you do a thread to the nose, when I see them on Instagram, I don't do them myself. I don't like them. I will not recommend them. But I'm also a scientist. I like to look at things from a very objective standpoint. When I see these videos on Instagram of thread lifts, all I see is a unidirectional pull. I see a thread in the tip of the nose pulling it upwards. And, I feel that there's more to making a nose beautiful than just lifting up the tip with a thread. So
and sometimes I just
that's
feel like
my take.
I feel like from that just light injection, they have some, lift or inflammation or I don't know. I really have a hard time believing that little strain can pull the cartilage upward.
Yeah,
more complications. So if, anyone's interested, perhaps you want to talk to your surgeon.
So we have another question from a guest regarding different techniques of lip fillers and also including Russian style lips.
Well, would you like to tackle lip filler since you are very good at it?
I really do enjoy doing lip filler. I don't use a particular techniques. I think everyone's anatomy is really different. And I know Russian lips becoming more and more popular, but I think you just have to really get to know your patients. If you have a 50-year-old patient, they don't want to look like a 20-year-old. So you just really want to make sure you do give them a result that it matches who they are. I think with the Russian lip is more like, decreasing the height between the upper lip and the nose, right? And, that's not my specialty. Again, I just really provide lip techniques that it matches the personality or what they're looking for. And some of this Russian lip technique that I see on Instagram, to me, they look like more like filter or it's been edited. It's really, I have a hard time believing that some of the results are real.
Yeah, I think it's more important to give natural looking lips that don't look like duck lips or camel lips. Have the ratio of the upper lip to the lower lip being a 2-to-3 ratio to give it a very nice natural result. So I feel that you need to see an injector or a surgeon doing your injections and look at the results and make sure they're going to give you natural looking lips, sexy lips, but not overdone. I think
absolutely
that's the way to do it.
Some of my patients that I see over a long period of time, when I assess their lips, I see a lot of lumps and bumps. So are you into dissolving the lips and starting all over fresh, or what are your thoughts on that?
So more and more as we do injectables now, people are asking for their lip fillers to be dissolved from elsewhere because they're not happy with them. My feeling is if you've had fillers for more than a year to 2 years, that filler is no longer dissolvable. That's now scar tissue.
Absolutely.
And a lot of people elsewhere, mostly not in the United States, but that come to us from abroad, have been told that their fillers were dissolvable when in fact they're silicone and they're not dissolvable. So, I feel that any type of filler that's been in the lips for more than a year to 2 years.
More like a scar tissue.
And sometimes I have to cut I have to do surgery. I have to do a lip reduction, basically cutting a strip of the lip that has the filler in it and make the lip a little bit smaller and a little nicer and looks more natural. But you can dissolve filler if it has happened in the last month or two, but I think long term the yield is low.
What are your thoughts on filler migration when it travels to the white part of the lip?
Filler migration is, I think, I guess a product of maybe over massaging or maybe the patients themselves massaging. I don't get to see it because when I inject my patients, I massage them and I bring them back 2 weeks later and I look at them and make sure that there's no migration. So I think if it's done properly, that should not be an issue.
All right, sounds good. All right, everyone. Any other question? Anything else we can cover?
Doesn't look like we have any more questions.
All right, this sounds good.
It's been fun.
It was lovely, yeah. So I know we're going to have 2 giveaways. So we're just going to go over some numbers and we're going to see who's going to be the winner of the giveaway.
Fantastic.
All right, Nurse Yalda, if you could pick a number between 1 and 30.
1 and 30? 28.
28. So for 20 units of Botox, we have Milan_Y464.
All right. Well, congratulations. So Milan, please feel free to call the office. Thank you so much for joining us on our Instagram, on our live. And definitely, we look forward to seeing you. And please go ahead and call the office tomorrow to book your appointment. Sounds good.
Great. And if you could pick another number from 1 to 30.
1 to 30. Number 7.
Number 7. So for number 7, we have Sunshine Lemons 23 for eye cream.
All right, Sunshine Level 23. Also, well, congratulations. Please feel free to stop by the office and we will have your retinol eye cream ready for you. Again, thank you so much, guys, for joining us.
Well, thanks for having me.
Oh my God.
It was a lot of fun, and I hope your listeners and your followers enjoyed it. I think it's all in the name of education and making sure that people make the right choices for themselves.
All right, guys. Thank you so much for joining us. Stay tuned and hopefully see you guys soon again. Thank you.
Take care.
All right.